Health Service Financing in Ghana. Hello and welcome to today's Sir Eric lecture on health service financing in Ghana, with a special focus on the National Health Insurance Scheme (NHIS). In this session, we'll explore a range of topics from global and international healthcare financing perspectives to the operational challenges and reforms of Ghana's NHIS. Let's begin by understanding the basics of healthcare financing globally and nationally. Global and national healthcare financing. Healthcare financing refers to the various channels through which funds are mobilized to support health services. Globally, financing occurs through 1. General taxation, funds collected by government and redistributed to healthcare providers. 2. Social insurance, contributions collected from individuals or employers put into a fund for healthcare. 3. Out-of-pocket payment, direct payment made by individuals at the point of care. 4. Foreign aid and charity, funds provided by donors and philanthropic organizations. In Ghana, the main sources of healthcare financing include 1. Government fund, 2. User fees such as the cash and carry system introduced in the 1980s. 3. Support from health development partners like WHO, UNICEF, and DFID. Despite these efforts, global healthcare financing faces challenges such as rising medical costs, budgetary constraints, and significant out-of-pocket expenses. Key challenges in Ghana's health financing. From a national perspective, Ghana's health financing system faces several challenges. 1. Dwindling government funding and donor support. 2. Facilities bearing operational costs like utilities. 3. Delayed reimbursement by the NHIS leading to increased healthcare costs. 4. Financial malpractices such as ghost workers and fraudulent withdrawals. History of Ghana's health financing. Historically, Ghana's healthcare financing has evolved as follows. 1. Post-independence. Free healthcare services were introduced in 1957. 2. 1972. Token fees were introduced. 3. 1985. The cash and carry system mandated significant upfront payment, creating financial barriers to care. 4. Exemptions. To address equity issues, exemptions were later introduced for vulnerable groups, including children, pregnant women, and the elderly. Public dissatisfaction with the cash and carry system prompted the need for an alternative financing model. Ghana Health Insurance Program. In 2003, Ghana enacted the National Health Insurance Act, Act 650, later revised as Act 852 in 2013, to establish the NHIS. This program aimed to 1. Replace the cash and carry system. 2. Provide equitable access to healthcare. 3. Ensure financial sustainability through a blend of social and public funding mechanisms. The NHIS operates 3 types of schemes. 1. District-wide mutual health insurance. 2. Private mutual health insurance. 3. Private commercial health insurance. Funding and coverage. The NHIS is funded through 1. 2.5% VAT on selected goods and services. 2. 2.5% SNIT contributions. 3. Parliamentary allocations and donor support. Exemptions apply to groups like children under 18, the elderly, and indigent. However, these exemptions, covering 60 to 70% of the population, strain the system. The scheme provides coverage for outpatient and inpatient care, prescribed drugs, and certain referral treatment. By 2021, active NHIS membership reached over 23 million, representing 77% of the population. Operational challenges and reforms. The NHIS faces challenges across three domains. 1. Scheme level. Weak claims management and delays in reimbursement. 2. Provider level. Limited accreditation and unauthorized charges. 3. Credits. I'm going to take the operational challenges and reforms again. The NHIS faces challenges across three domains. 1. Scheme level. Weak claims management and delays in reimbursement. 2. Provider level. Limited accreditation and unauthorized charges. 3. Client level. Overutilization and abuse of the system. To address these issues, reforms include introduction of an electronic claims management system, strengthen audits to reduce fraud, mobile renewal services to improve membership retention, sustainability and way forward. The sustainability of the NHIS depends on balancing revenue and expenditures. Key measures include establishing a standardized tariff system for services, enhancing collaboration between public and private providers, expanding the NHIS coverage to ensure inclusivity. Conclusion. In summary, Ghana's NHIS is a pioneering model in Africa, striving to achieve universal health coverage. Despite its challenges, it remains a vital social intervention. Continued efforts in technology, policy reforms, and collaborations will be essential to strengthen the scheme and ensure its sustainability. Thank you for listening to this detailed discussion on health service financing in Ghana. Stay tuned for more educational content. This is Sir Eric.